Hello everybody, I am Dr. Sudhansu. I am DNB consultant physician. I am here to discuss an anxiety disorder today. So what is anxiety? Anxiety is a hyperarousal state characterized by feeling of tension, worried thoughts, and it shows some physical changes like tremor, increased blood pressure and sweating. Incidence of anxiety is somewhere around 10 to 20% in our country, and there are several risk factors that are associated with anxiety that we'll be discussing in coming video. So what are the symptoms of anxiety? The symptoms of anxiety is mainly categorized into emotional symptoms, motor symptoms and autonomic system. In emotional symptoms you might have nervousness, irritability, dread feeling, insomnia, exaggerated response, easily distractible, not able to concentrate. So these are the basic emotional symptoms. In motor symptoms you might have tremors, twitching, shaking, fatigue, generalized muscle ache and sometimes paresthesia also. And in autonomic symptoms it is categorized into cardiovascular symptoms, gastrointestinal, genitourinary symptoms and neurological symptoms. In cardiovascular you might have tachycardia, shortness of breath, chest pain, sweating, cold and clammy extremities. In gastrointestinal you might have choking feeling, dysphagia, heartburn, nausea and vomiting, abdominal pain, anorexia, and in genitourinary you might have frequent urination. And neurological you might sometimes feel dizziness, headache and sometimes loss of consciousness also. So these are the basic symptoms of anxiety that we all should know. So what are the types of anxiety disorder? Anxiety disorder mainly has 5 types. Number 1 is generalized anxiety disorder, in which people will have anxiety most of the time. Number 2 is panic disorder. People will panic in small issues. Number 3 is obsessive compulsive disorder, in which people have some obsession to do something at particular moment of time, like they keep on washing their hands, someone keep on checking, someone have thoughts of doubts in their mind. So that is known as obsessive compulsive disorder. Fourth one is post-traumatic stress disorder. Because of some trauma in the past, whether it can be physical, mental or social trauma, they keep on having anxiety, which is categorized as post-traumatic stress disorder. And the last one is social phobia, in which people will not want to attend any social function. They will try to get anxiety whenever they have a question of socialization, attending a function, group gathering, etc. So these are the 5 major types of anxiety disorder. So there are few risk factors for anxiety disorder. Number 1 comes female gender. It is usually seen and observed and statistically proven that female gender are more prone for anxiety. Number 2 is childhood trauma. It can be social trauma, physical trauma, mental trauma that they have undergone childhood, which usually results in anxiety in their further life. Number 3 is physical illness. Might be someone having life-threatening illness or illness that can end in life, and that they know about it cause them anxiety. Recently we have seen so many people, they had anxiety just because of COVID, because of the awareness, because of the talk, because of the discussion about the severity of COVID. Lot of people, they develop anxiety. Number 4 is stress itself is a risk factor. Some personality disorder like type A personality, they all have more propensity to develop anxiety. Anxiety is also thought to have some genetic connection. Some people they have anxiety that is carried from their gene. Substance abuse, taking alcohol, smoking, tobacco, these all are the substance abuse. Some family discord, family not exposing their child to challenge facing environment, always helping them, living in accommodation, big accommodation. So these all sometimes create anxiety when they have to face situations and challenges in their real life. And sometimes in elderly female during menopause also create some sort of anxiety. So these are the basic few enlisted risk factors for anxiety. Now question arises, when to see a doctor? When we think that the symptoms that I have already spoken has really occurred in us and things are not under control with basic counseling and your own trial, then you should always try to see a doctor so that it can be properly analyzed, counseled, and if necessary, treatment should be initiated. So coming to the last point of our discussion for anxiety. So what are the basic preventive things that we can do to prevent anxiety? First and foremost thing is taking care of your body, taking health as a priority, doing regular exercise, eating balanced diet, finding time for yourself, grooming your interest and hobbies. Either it can be whatever, either gardening, reading, traveling, music, movies, studies, whatever. You should always have time for yourself. And we should try to trim a hectic schedule in this present world. Everybody has so much of tight schedule. We should try to trim as much as possible. Limit our activities that we do not find relaxing, that we should not do. We should try to cut down the friend circle or whatever things that does not make us relax. And to the most, we can keep the journal of our anxiety, and whenever we are approaching to doctor, we can show that journal. The doctor can analyze it properly, how frequently it had occurred. So it helps them to come to a better conclusion about the problem, severity, and decides them for the line of management. Thank you very much for listening on anxiety, and I hope it might be helpful for you in many ways. Thank you.